Greetings, all. This is a training being conducted about infectious prevention and control. This presentation is being presented by Jennifer Willis from the Willis Group moving forward. And today, we just want to talk to you about, again, infectious prevention and control. We are an agency that works with various populations, typically in a community setting, but this training is specifically to discuss how to prevent and control infectious diseases with our individuals that we serve with disabilities. The purpose of this training is to provide a basic understanding of infectious prevention and control, the expectation of implementing control over infectious diseases in the workplace and in working with individuals with disabilities. From this training, you should learn what an infectious disease is, standard and transmission-based standards, proper hand washing, personal protection equipment, and resources. So we're going to start with talking about what infectious diseases are. And as stated, infectious diseases are disorders caused by organisms such as bacteria, viruses, fungi, or parasites. Many organisms live in and on our bodies. They're normally harmless or even sometimes very, very helpful. But under certain conditions, some organisms may cause diseases. So an example of an infectious disease is in our current times now, COVID-19, the flu, hepatitis, malaria, tuberculosis, also known as TB, meningococcal meningitis, HIV, and AIDS. These are just a few of the infectious diseases, but not an all-inclusive list of what are examples of infectious diseases. How are they contracted? Some infectious diseases can be passed from person to person. Some are transmitted by insects or other animals. And you may get others by consuming contaminated food or water or being exposed to organisms in the environment. One thing that is not on the list, as we do talk about infectious diseases, as we just mentioned, HIV, AIDS, one of the ways that is transmitted from person to person through sexual intercourse. So there are, of course, again, multiple ways that individuals can get contracted infectious diseases. So we'll talk a little bit more about that as well. And that is also very detailed in our company infectious control policy. Here are some signs and symptoms. Signs and symptoms may vary depending on the organism causing the infection, but often include fever and fatigue. Mild infections may respond to rest and home remedies, while some life-threatening infections may need hospitalization. We again will talk about some signs and symptoms as it pertains to like COVID-19 in particular that you may experience, and again, those signs and symptoms, some of them are pretty common in terms of other infectious diseases. Point 2, many infectious diseases such as measles and chickenpox can be prevented by vaccines. Frequent and thorough hand washing also helps protect you from most infectious diseases. As we continue in discussion with regards to infection control and prevention, you will notice that we will talk very much about hand washing and how that helps again to protect and prevent infectious diseases. We will now talk about infectious control basics. There are 2 tiers of recommended precautions to prevent the spread of infections in various settings. Our first control is standard precaution, and our second is transmission-based precaution. standard precautions for all patients or clients in our particular language. Standard precautions are used for all patients in client care. They are based on a risk assessment and make use of common sense practices and personal protective equipment that personal protective equipment use that protect healthcare providers and our staff in particular from infection and prevent the spread of infection from patient to patient or client to client, staff to staff, person to person. One thing that is important to note about standard precaution for our clients is that, again, a lot of the things that we will discuss is common sense practices, as well as using your common sense in conjunction with personal protective equipment. Transmission-based precautions are used in addition to the standard precautions for patients or clients with known or suspected infections. And so with the transmission, what we're discussing is really if you know that a person is infected, for the sake of an example again, with HIV or AIDS, then there are different precautions that you're going to take because you do and you are aware that this person is infected. And that's just one example. In addition to, in relevant in today's times, we're talking about COVID-19 as well. There are different precautions. If a person, say, were hospitalized with COVID-19, there are transmission-based precautions that we would take in conjunction with, again, our standard precautions. And we'll talk a little bit more about that in the next few slides. Transmission-based precautions, they are intended to supplement, again, to use in conjunction basically with our standard precaution in patients or clients with known or suspected colonization or infection of highly transmittable or epidemiology important pathogens. These additional precautions are used when the route of transmission is not completely interrupted using our standard precautions. So again, we're using our transmission-based precautions when our standard base, and which we'll talk about in a moment, are not just enough. We are talking about transmission-based precautions first, which is not typical in a training such as this one. You usually talk about your standard precautions, but the reason that we are talking about transmission-based precautions first is simply because because of the setting in which we work in. We're not usually in a setting such as a hospital where transmission-based precautions are seen and used more frequently. So there are three categories of transmission-based precautions. First one including contact precautions, droplet precautions, and airborne precautions. For diseases that have multiple routes of transmission, a combination of transmission-based precautions may be used. So again, you can use different types of precautions because there can be overlapping in the routes of transmission for different types of diseases in particular. So we're going to talk about the droplet precautions. We are using this form and we're referring to here our blue form, our form that is outlined in blue. Not everything on this form is applicable for the individuals that serve our particular clients because, again, of the setting. And this is, again, why we're talking about transmission-based first, because we don't work in usually a hospital setting. However, we do work in the group home settings, and we may have to have a mock of a hospital setting in case one of our individuals were in a situation where the disease was like so. So with droplet, when we're talking about the droplet precautions, Droplet is just meaning that, well, you use it when caring for patients or clients who have diseases that are spread by droplets or dust particles, such as coughing, sneezing, or talking. Um, so those types of the types of diseases that would be applicable to is like mumps or influenza. And so, if a client or a patient had the mumps or influenza, then again, we would be taking these precautions for patients that are isolated. So, as we said in the beginning, we're talking about, again, you're going to want, number one, decontaminate yourself. So, you're going to decontaminate your hands before entering any room where this patient may be, and decontaminate by sanitizing or washing your hands before entering. Then you're going to use your personal protective equipment. And so, what's recommended is to wear a disposable apron, fluid-resistant surgical mask, eye or facial protection, and gloves before entering the room. In particular, door closed is a no at this point. But again, if we were in a situation like this, we would rely on the guidance of medical professionals as to whether or not to leave the door open or closed. Before leaving the room, we are going to properly dispose of the personal protective equipment that we have on. So we're going to decontaminate that equipment and take it and remove it off properly, as well as dispose of it properly. And once we've disposed of it, we're going to again decontaminate our hands. Okay, so for our uh, other side, our right hand side of the screen, in our yellow flyer, this is contact precautions. And so this is for, individuals where you could be um, where it could be direct skin to skin contact or indirect contact with contaminated equipment. So, again, following our same procedures, before you enter a room or before you come into contact with that particular patient or client, you're going to decontaminate your hands, again, by washing or sanitizing your hands. Then you're going to go ahead and use your personal protective equipment. So you're going to wear disposable apron, gloves before entering the room. When it's skin to skin, in this particular setting, you're not necessarily required to wear a mask. So here again, they're telling you to keep the door closed. And again, for these purposes, again, you're going to rely on what a medical professional recommendation is in terms of keeping the door open or closed. Okay? Before you leave, you are going to properly remove your personal protective equipment and dispose of it properly. And again, upon leaving that particular area or working with that particular client, you're going to decontaminate your hands. In our next slide, it's a flyer in reference to airborne precautions for patients that are isolated. Airborne is when caring for patients whose diseases are spread through the air. So airborne. So some examples of things that are diseases that are airborne: tuberculosis, chickenpox, and measles, again, are airborne. And so before working with that individual, you're going to, again, decontaminate your hands. So wash, sanitize your hands before entering that patient's room or space or working with that patient. And again, you're going to utilize your personal protective equipment. So wear disposable apron or gown, FFP3 or N95 mask or respirator, eye and facial protection, gloves before entering the room. So you want to have all of your PPE on you, properly placed up on your persons before entering. Then again, keeping the door closed again so that you can, again, I won't even say on this instance, but using the direction from a medical professional, but keeping the door closed because it is airborne, then it has the potential to spread throughout the air, which also could infect or contaminate others or other things. Before you leave, you're going to decontaminate the equipment as well. So surfaces around you as well is another thing that can be decontaminated. Dispose of those items properly, and after you've left the room, remove your respirator and discard in a healthcare waste bin. So properly discarding our PPE as well. And not reusing that respirator mask as well. And then again, same as your first step, and very, very important, you're going to decontaminate your hands. We're going to look at standard precautions now. Standard precautions represent the minimum infection prevention measures that apply to all patient care and clients, regardless of suspected or confirmed infection status of the patient or the client, in any setting where healthcare is delivered or service for our purposes. These evidence-based practices are designed to protect you, the healthcare worker or the staff person, and to prevent the spread of infections among patients, staff, and the community as a whole. Standard precautions include hand hygiene, the use of personal protective equipment such as gloves, gowns, and face masks, depending on the anticipated exposure, respirator hygiene and cough etiquette, safe injection practices, and safe handling of potentially contaminated equipment or surfaces in the patient's environment. The first thing that we'll look at in terms of standard practices or standard transmission is washing your hands. So here's an example. Here's a flyer for an example of how to wash your hands by number 1, wetting your hands, 2, getting soap, 3, scrubbing for at least 20 seconds, 4, rinsing your hands, and 5, allowing your hands to dry. And drying your hands with a paper towel or a clean object. In our infectious control policy, company policy, our company policy is a little bit more detailed than this particular flyer because it really does tell you how to scrub your hands, how to wash your hands during those 20 seconds, how to really apply enough soap, because sometimes based on this visual that we see here, there's only a small drop of soap, but it's important to make sure that you apply enough soap to cover all of your hand surfaces. Once you're on step 3 to scrub for at least 30 seconds, you want to make sure that you're going hand over hand, left hand over right, right over left, getting the palm of the hands, getting in between the hands, making sure that you're getting the back of the hands as well, and also inside of your thumbs, and just rotating and really rinsing for the washing for those 20 seconds, and then rinsing your hands with water. Again, drying very thoroughly with a single-use towel and turning the faucet off, turning the water off using a towel. In conjunction with that, if you were in a restroom in particular, or in a location where there is a door for your need to exit or move from one space to another, using a towel or a napkin to open the door of that area, just again to make sure that you are not recontaminating your hands. Okay, we will see that slide for our infectious control policy and our infectious control manual, a more detailed slide. Now we're going to talk about key times to wash your hands. Washing your hands before you do something. So in particular, washing your hands before you eat, or if you're preparing food, washing your hands before you prepare food. washing your hands before you touch your face in particular. And again, in referencing our um, manual, infectious control, a company infectious control manual, uh, it goes a little bit more detailed, but we're in particular, wash your hands before you're caring for someone at home who is sick, who may be vomiting or have diarrhea, and washing your hands before you treat a cut or a wound. Okay, so some key times as well about times after you've done a particular thing of washing your hands. Washing your hands after using the restroom, after coughing or sneezing, after leaving a public place, after handling a mask, after changing a diaper, after caring for someone who's sick, or after touching an animal or a pet. Again, just as a reminder, in our previous slides, we talked about how some infections may be transmitted, and this is one of some of the ways where it can also be transmitted, and that's with touching an animal or a pet. Or again, we're talking about washing. I would also add on here washing after you've prepared food or while you're preparing food as well, because again, it can be transmitted through raw foods as well. This information is coming from the CDC. So we do consider the CDC to be a very reliable source in giving us recommendations on how to prevent and control infectious diseases. In the next couple of slides, you will see there's a sequence when we're talking about our PPE, personal protective equipment, on how to put that protective equipment on. It talks about, again, when you are using personal protective equipment, it is not a full PPE is not required for the settings in which we work in. So a gown and goggles, gloves, and all those things are not necessarily required. What is required for us as an organization is the use of a mask. That is a requirement. Our organization does also have access to face shields and gloves. So this is we've discussed this in particular in previous trainings as it pertains to gloves. But anytime, for an example, that an individual is administering medication to a client, then we should be utilizing gloves to administer that medication as well. So a gown isn't necessary or required at this time in our organization with any of the individuals that we service, but these are ways, information on how to put it on. And so for us in particular, let's just cover it really quick. If you were to be using all of these PPEs, you would first put on a gown, then you'd put on your mask, then you would put on your goggles or a face shield, and lastly, you would put the gloves on. So keep in mind that when you are in PPE, it is important to keep your hands away from your face, limit the surfaces that you touch, and change gloves when they become torn, or if they become torn, or if they are heavily contaminated. And then again, just perform hand hygiene. Our next slide talks about how to actually remove your PPE. You're going to start with removing your gloves first. Once you removed your gloves, just as a precaution, go ahead and sanitize and or wash your hands if you can do so without contaminating other things. But you should be definitely ensuring that you have clean hands. Let me just say, if you take the gloves off properly, some type of a sanitizer, an alcohol-based sanitizer, or washing your hands. Once the gloves are off, There is a visual here to demonstrate how to properly take your gloves off, followed by taking off your goggles or your face shield, followed by taking off your gown, then taking off your mask or a respirator. And after you've done that, step 5 would be to wash your hands or use an alcohol-based hand sanitizer immediately after removing all of the PPE. It is noted here at the bottom that performing hand hygiene between steps if hands become contaminated and immediately after removing it. So again, hand washing, hand washing, hand washing, hand washing. We'll keep saying that. So on this next slide, again, it is talking about how to properly remove your PPE. This is just a second way to remove that, how you can remove essentially your gown and your gloves at the same time. So the only difference between this slide and the previous slide was you're removing your gown and your gloves at the same time. And on the previous slide, you're removing your gloves first, then your goggles, and working your way down to your gown. But you can safely remove your gown and your gloves at the same time and then working your way down to removing. Most importantly, again, is not to touch your face in particular, and also just to perform good hand hygiene. As we just mentioned, for our organization, in working with the individuals that we service, whether you're in the group home setting or whether we are going to visit with the client face to face, we are required to wear a mask. And so, in that requirement to wear a mask, we want to just talk to you again about how to safely wear a mask. The mask is designed to wear over your nose as well as your mouth, and those things. The mask should be placed securely over your nose and your mouth. Step 1 in wearing your mask correctly: wash your hands before putting your mask on. Put it over your nose and mouth and securely under your chin. Try to fit it snugly against the sides of your face so that there are no gaps between your face and the mask. And make sure, of course, most importantly, that you can breathe. And it is also not recommended to place a mask on a child that is younger than the age of 2. So again, in wearing your mask, use a mask. The use of the mask helps to protect others as well. So in wearing your mask, you want to use it in case you are infected as well, because sometimes we can be infected and be asymptomatic, meaning that we're sick, but we're not showing any symptoms of our sickness or our ailment. In the public, if you happen to be in the public and working for our agency, making sure again you keep your mask on the entire time that you're in public. Making sure that you keep your mask on the entire time that you are working with clients as well. Whether you are in the home or whether you are doing a home visit, making sure that again our mask is on to protect ourselves and protect the people that we are servicing. A pointer with the mask: you should not place the mask around your neck or on your forehead or hanging off of your ear or hanging off of your elbow. It should be on your face. Do not touch the mask, and if you do, make sure that your hands are clean when you are touching your mask. Also, for those individuals that are wearing cloth masks, making sure that we sanitize our masks daily as well, that we are sanitizing by washing or using some other form of sanitation so that our mask is clean and sanitized upon each daily use, or changing our mask each day if it's not a cloth mask and you're using something such as a surgical mask. The other points here on the PowerPoint talks about following everyday healthy habits, and that's staying 6 feet away from others, avoid contact with people who are sick, wash your hands often with soap and water for at least 20 seconds each time, use hand sanitizer if soap and water are not available. Again, when you take your mask off, do that carefully when you're home. Untie the strings behind your head or stretch the ear loops. Handle only by the ear loops or the ties. Fold the outside corners together. Place the mask in the washing machine and wash your hands with soap and water. And this again is something that should be done daily. There is a note here at the bottom that says personal masks are not surgical masks or N95 respirators, both which should be saved for healthcare workers or other medical first responders. And we are in our role and our capacity considered essential workers. So this, in a sense, does not apply to us. And if we have the ability to use N95 respirator mask, please also do that as well. Again, this information does come from the CDC and is considered a reliable source. Key times to clean and disinfect your home. In this particular slide, we are referencing key times to clean and disinfect our group home settings to ensure that that the people that we service are being kept as safe as possible. But this also does apply to anyone in their home as well. If we are talking about host homes as well, this is applicable to those homes as well. So some key times. Key times are daily, and we want to disinfect daily. We want to disinfect our tables, our doorknobs, our light switches, our countertops, our handles for desk handles, phones, keyboards, toilets, faucets, and sinks. That also includes remote controls. So especially for us sometimes, because iPads as well, disinfecting those things as well. We want to make sure that we change those and disinfect every time there's a staff change, making sure that we're doing that. So in our line of business, we are doing that at least 2 to 3 times a day, and 2 to 3 times because usually we have 2 to 3 staff members that are doing a shift change in a day, depending on what day it is. So again, daily, just making sure that we're sanitizing through Lysol, alcohol, or any of the other disinfectant sprays or items that we have provided in our homes. If someone is sick in the home, after they touch any of the additional surfaces that someone else in the home may touch, like the bathroom surfaces, utensil, light switches, remote controls, iPads, stove, all those types of things, tables and that kind of things, we want to make sure that we disinfect far more frequently, again, if we have someone that is home. So in particular, just as a note here at the bottom, when we're talking about clean, in particular in the group home settings, and even in your daily home setting, it does not work if you disinfect the space and that space is not clean. So for an example, if we're talking about disinfecting countertops in particular, if that countertop is not a clean surface and there's food or there's sticky items on that countertop, and then you disinfect that countertop, then it is not clean and it is not disinfected. So we want to use soap and water to clean dirty surfaces prior to us disinfecting that area. And so even if we're using not just soap, but we have plenty of other type of cleaning products that are cleaning supplies. So clean, then disinfect. Just as a note and a reminder, if you are in your own personal home, making sure that we keep cleaning supplies out of the reach of children and pets. This slide is a slide that does discuss how to make your own disinfectant. If you were without a disinfectant, there are three options here to choose from on how to make uh, disinfectant. So for us in particular in the group home settings, we are totally overstocked and will always and always have had bleach in particular. And so when we can make disinfectant out of bleach. Before you do make disinfectant using bleach, just be sure that you wear required PPE, gloves, masks, those types of things, and making sure that you are in a ventilated area. And so you would use bleach as well as water to make a disinfectant. You do not need a lot of bleach in particular. You could use 400, as our example shows us, 400 milliliters of bleach and 20 liters of water to make a disinfectant. So you only need your disinfectant only needs to be 5% bleach based on whatever size that you use. For us in particular in the group home setting, we do not use buckets in particular, but we do have spray bottles. So you could utilize um, a spray bottle and using that spray bottle to decontaminate the home, not decontaminate, disinfect the home. So again, you want to stir or shake, wait for 30 minutes, clearly label whatever bottle or container that you are using, labeling it that it contains bleach as well, and then covering it and keeping it out of sunlight. And so there are here at the bottom of the screen, just talking about the supplies that are needed. Most importantly, do not mix your chlorine solution such as bleach with any other cleaning product. So for an example, you would not mix bleach with peroxide, or mixing bleach with ammonia or any other type of cleaning supplies, as it does change the chemical and change the product to something that could be explosive or highly dangerous if within the presence of the wrong person. So again, there's also a warning here at the bottom. Do not put chlorine or bleach solutions in your mouth or your eyes, or inject or ingest any of the solution. Okay. As stated earlier, we sort of kind of talked about some of the signs or symptoms of different types of infectious diseases. These are some signs and symptoms currently in terms of COVID, but also can be applicable to other infectious diseases. So if you have any signs or symptoms of a fever or chills, a cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headaches, loss of smell or taste, a sore throat, congestion or runny nose, nausea or vomiting or diarrhea, then of course we ask that you stop. If you're trying to enter one of our group homes or host home, or even in scheduling an appointment with our staff, we ask that you refrain from doing that. And we also ask that you refrain, just as a citizen of moral value, from going out into the public and possibly infecting others. Again, we want to encourage you highly to wear a mask, and whenever possible, maintain a distance of 6 feet away from others. In our group home setting, it is not possible for those individuals while in the home to remain 6 feet apart at all times. But we do again require that staff, and as a reminder for staff must wear a mask at all times while working with the individuals that we service, whether that's in the group home or doing home visits. Again, we've talked about and referenced, and so we want to have an opportunity to show you just a little bit of our infectious control policy. And this is our company policy in particular, and this policy is available at our office, at our main office, as well as located in each of the group homes where clients are residents. So this is our infectious prevention and control policy. And so what it does do is it talks again a little bit more detail about what we've already discussed. What is a infectious disease? What are some of the symptoms as stated here? Again, it can be pretty common. Doesn't mean you have all or some of these symptoms, but some of the symptoms again are fever, diarrhea, fatigue, muscle aches, and coughing. And so again, it talks about infectious diseases, bacteria, virus, fungi, and parasites, and what those as well look like and how they are defined. We talked about direct contact, person to person, animal to person, mother to unborn child as well, are just some ways, again, that you can be infected through direct contact. Indirect contact would mean, again, insect bites as well. I do want to go back. Let me just say this. Indirect contact here, diseases causing organisms that can be passed by indirect contact. So again, we're talking about the fact that germs linger on objects such as tabletops, doors, doorknobs, faucets, handles, that kind of thing. So again, that's why it's important for us in particular to make sure that we are disinfecting tabletops, doorknobs, and all the things that we previously mentioned. Again, when you touch a doorknob that's handled by someone who's ill with the flu or cold, for an example, you can pick up germs that he or she has left behind. So then what happens, again, we're talking about frequent hand washing, and the reason being is because you've touched that surface in particular that someone who may have been sick may have touched, and then you go and rub your eyes, or even if you cough, you're then now touching your mouth or your nose. So again, just make sure that whenever you come into contact with touching surfaces, whether you're in a place of business, whether you're just out in the community, or it could be at the park, pushing a child or helping a child off a slide, any of those things, anytime that you come in and out of any particular location, you just want to make sure that you are washing your hands or sanitizing your hands every time that you change locations. But again, indirect contact could be insect bites as well. And that could be from mosquitoes, fleas, lice, or ticks as well. Food contamination, and then it talks about risk factors. Again, here we've talked about, we did briefly mention about HIV and AIDS as being, one of the diseases as well. But there are many other things that, we're talking about, like cancer as well, steroids, so on and so forth, that are risk factors for getting an infectious disease, or those things themselves being infectious disease. But again, we talked about prevention, and as we see, it is overly stated, and I won't even say overly stated, but stated repeatedly because of the importance of washing your hands. Okay, so our policy just goes, through, and again talks about the things that we just discussed, but we talked again in our policy about standard precautions as well as transmission-based precautions, and now knowing the difference between the two as well. Again, as we keep saying, hand hygiene as well, but also you can use an alcohol-based hand rub or sanitizer as well, or just simply hand washing with soap and water for 20 seconds. Again, a lot of our information is coming from the CDC as well as the WHO organization, which is the World Health Organization. And then there's just some additional information about washing your hands and not to, again, touching any place on your face with unwashed hands, as well as preparing food surfaces, so on and so forth. We talked about key times to wash our hands. We've also talked about personal protective equipment, also known as PPE, gloves, gowns, those types of things, as well face protection, as well respiratory protection as well. And then we talked about how to remove our PPE as well with visuals. There in the remaining of our infection control policy, we do have again some visuals and just some information on how to utilize PPE, gloves in particular, when to use gloves, when not to use gloves as well. Sterile gloves, we haven't talked in detail about that, but there is some information in here about that as well. Again, how to put our gloves on and how to remove them. And then this is what we referred to earlier in our presentation, talking about a more thorough way to wash your hands. And again, applying enough soap to cover everything, not just a drop of soap, but rubbing your hand palms together, left hand over right hand over left hand, in your palms, the back of your hands, rubbing your thumbs. So it just gives you a very good breakdown of how, what you should be actually doing during those 20 seconds of hand washing. Then rinsing our hands, drying them thoroughly, and again, using a towel to turn the faucet off. And then hopefully your hands are safe at that point. Okay? So we just wanted to really sort of kind of go over that again and just give you a summary of what it was that we discussed in our PowerPoint slide on our infectious control policy. For individuals who are employees of the organization, we want to test your knowledge. And so there is an assessment that is required for all individuals who are employed by the Willis Group moving forward. Here is that link for that assessment and that requirement to maintain employment as well as to be offered employment. This assessment must be completed. You must make a score of 70 and above in order to show your knowledge of our infectious control policy. Okay? Again, in taking your assessment, you are more than welcome to utilize resources as well as use our infectious control policy handbook itself as a resource for your assessment. The resources that we have used in regards to this particular PowerPoint, we have used resources, the following resources, so giving credit to our author of much of the information that we have shared with you in this PowerPoint. We again have used and relied on the CDC for a lot of our information, as well as the World Health Organization. And so if you want additional information about the infectious control policy or what infectious control is, again, we highly encourage you to visit resources from the CDC, which is the Center for Disease Control and Prevention, as well as the WHO organization, which is the World Health Organization. Should you have any questions or need to contact the presenter or staff for the Willis Group moving forward, please utilize the below information to contact us. And again, my name is Jennifer Willis, and it's been a pleasure providing this presentation for you guys today. Be well, be safe, and remember, hand washing and the use of masks is a big contributor in preventing the spread of infectious diseases. Be well.